Let's talk now with an expert. Dr. Anne Rimoin is a professor of epidemiology at the UCLA Fielding School of Public Health. Welcome back to The Story Is.
Thanks for having me.
All right, Anne, so if you are a parent or a grandparent who's got young kids or a baby maybe that was just born, how should you think about this?
Well, Alex, thanks for having me. And I think that what we're seeing here is a lot of opinion, a lot of discussion about intuition, and not a lot of discussion about science and evidence here. And what concerns me the most is that we're considering making major changes to childhood vaccination policy without evidence that those changes are going to improve health. So to answer your question very specifically, if I were a parent, what I would want is to follow the science and follow the data that is actually out there. And I would talk to my pediatrician. I would look at the medical associations like the American Academy of Pediatrics, who are very clear on this topic. And I would really follow the data and not intuition or feelings.
I mean, this idea of spreading out the vaccine, the president said this about what happens to babies.
I saw this early on, and I've seen proof of it, where they have a vaccination thing, looks like the size of a bottle of soda, poured into a little child's body.
Has there ever been a bottle of soda sized vaccine poured into a child's body? And what do you make of this idea of spreading them out? Is that helpful in any way?
Okay, so the first point, this is just a rhetorically vivid kind of a statement, but it's biologically meaningless. We measure vaccines in fractions of a milliliter, not in terms of big doses like he's discussing. And I think that what the bigger question here is, what is the evidence? You know, I'm an epidemiologist. I like data. I'm a scientist. So I'm asking, if we're going to be making changes to policy, where are the data? There are no data that suggest that spacing vaccines out will be safer for children. If those data exist, we should study them, but there are no data that suggest that. What data do exist are the data that are showing that if you are going to separate these vaccines, right now it's a 2-dose vaccine. If you separate it, now you're getting 6 doses total, right? 3 vaccines, 2 doses of them. That means that parents are going to have to go to the doctor more frequently. And while these vaccines are covered in principle, you know, time is not free. Parents have to take time off of work. Children have to be pulled out of school. Sometimes people have to have more childcare. How are they going to get to wherever the vaccines are going to be distributed? You know, that's all important. And there are data suggesting that the more vaccine visits you have, the less likely a child is going to be able to finish their vaccine schedule. And that means that children may, with this new schedule, be less protected overall.
And to that point, Bill Cassidy, who is a senator from Louisiana, Republican, who voted to confirm RFK Jr., now putting this onto X, quote, "I'm a doctor. This executive order is wrong. The president does not have the expertise to make these changes. Vaccines are overwhelmingly safe. Vaccines are effective. Vaccines do not cause autism. Breaking up vaccines will mean children have to get the shots, the same protection, not fewer shots. It will increase hesitancy and make children less safe. Parents should listen to their child's pediatrician about vaccines rather than listening to inaccurate executive order. This is so wrong." Bill Cassidy, of course, who was not endorsed by President Trump and will not be returning to the United States Senate. But in terms of the autism link, there's been so much said about that for years, especially by the current HHS Secretary, Robert F. Kennedy Jr. Break down the data in terms of what you've seen, vaccines and autism.
Well, I think the thing that's really important here is to understand how these studies are done. There are many studies done over decades in multiple countries, hundreds of thousands, millions of children studied. You look at what the exposure is and what the outcome is. So you look at, have children been vaccinated? Are those children, or have they not been vaccinated? Have those children who have been vaccinated, do those children have a greater risk of having autism? Are the rates of autism higher in children who have been vaccinated versus those who have not been vaccinated? There are no, studies do not indicate that there is any link between vaccines and autism. The studies do not demonstrate that children who are vaccinated are more likely to be autistic than children who are not vaccinated. And that is where the data stand. I think it's perfectly reasonable to ask questions and to do studies, but when the studies that are done show you over and over again that there is no link, then the job is to accept the evidence and make policy based on evidence, not based on intuition or feeling.
Yeah, this whole thing today sort of feels like a solution in search of a problem. Anne Rimoin, thank you so much for sharing your expertise. Really appreciate it.
My pleasure. Thanks for having me.